Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey El Paso, this is Dr. David over at El Paso Manual Physical Therapy. I'm the host for the Stay Healthy El Paso podcast. And what we're going to be talking about today, we've had tons of patients in the clinic coming in with neck and shoulder problems, and over half of them have been asking this question of, why do I have this neck hump on my back, on my upper back, lower neck, kind of where the two places meet? They'll reach over behind their neck and point exactly to where it's at, and it's that lower neck area. And in some of these people, it's painful, and others it's not. But all of them are concerned about it. They all know that something's not right. It's not normal. It wasn't there before when they were kids or when they were younger. And, you know, it's something that's kind of weird. It's unsightly for some ladies, especially. I see all the ladies that have this problem, they wear their hair down most of the time because they don't want that part of their back exposed. They're afraid to cut their hair shorter than, upper back length because they want that part of their upper back, lower neck area covered up by their beautiful hair. So I'm going to go over 4 contributing factors to this. And then we're going to talk about the top 4 ways to reverse the neck hump, because in just about everybody, there is a small population that this isn't the case, but in just about everybody, the neck hump can be reversed. It may not be 100%, but it can definitely be reduced and managed properly. And most importantly, this neck hump can cause some bad stuff. So if we can reduce it or control it so that it doesn't get any worse, then you're in the best position to continue to be active, healthy, and mobile while avoiding any sort of unnecessary surgery, medications, or having to get injections for this problem. We see people get injections for this all the time, unfortunately. So let me go into those 4 contributing factors. Number 1 contributing factor to the neck hump is posture. When I talk about this, though, I'm giving this the number 1, place, but that does not mean that it's the priority. With posture, of course, if you're slouched forward, the classic computer posture where your face is closer to the computer and your hands are on the keyboard, when your head juts out forward on your body, it will make that hump appear just a bit more. So I put posture here just because it's the most common one that people think of, and it's definitely an easy fix relatively to the other ones, but it's not the most important thing to consider. So I just want to highlight that part, because just about all these ladies that are coming in right now with their poor neck humps and they're concerned about it, they all tell me, I've been working on my posture and I just can't seem to get rid of it. And so I believe them. I think that they really are, at the desk trying to sit up straighter and be taller and all that. And it's just not working out for them because it's not the biggest priority. There's other things that we'll get into here in a second that are way more important and that are going to affect the neck hump way more than if you just try to sit up straighter. But posture is definitely a contributing factor. So if you're out there with a neck hump issue and whether it hurts or not and you're just concerned about it, you want to definitely work on sitting up taller. Now, the reason that most people will lean in and they'll put their face closer to the computer screen is because they might have trouble seeing the screen. So think about this. If you have trouble seeing the screen, is it maybe time to get some new glasses, get some reading glasses if you're having trouble reading small text? Or maybe you need to play with the fonts on your computer and see if you can zoom in on things. The computers these days, they're all very manipulatable. You can change the fonts and screens and zoom in and everything. So work with that if that's an option for you. But of course, mobile devices are the other screens that we look at, our phones, our tablets. And what I always tell people, if posture is a big concern for you while you're using your mobile device, you need to get in the habit of bringing that screen a little bit closer to your face using your hand, not by leaning your head in towards the screen. So literally, you've got to pick up your hands and figure out a way to rest your elbows on something, get a better setup with your, if you're doing this in bed or on the couch or wherever you tend to use your mobile device, you need to make sure that you're not slouching over with your head to look at your screen. As best as possible, you want to bring the screen up to your head. Our shoulder joints and elbow joints are best designed to move like that. It just might be that your muscles aren't as strong to keep it up there for a long time. So you have to just accommodate your posture, your sitting posture, to hold up that tablet or that phone up against your face. So get your eyesight checked and check your sitting posture. Now, the second factor here, and I would go to say that this one is probably the most important by just a smidge, strength. The strength of the muscles that support the upper back and the lower neck area is critical in making sure that the alignment and the stability of all the joints and bones in the area are properly aligned, properly strengthened, and spaced out. It's a big, big, big deal. And that's the number one thing that I'll start fixing with somebody that's coming in for a neck hump related problem, is we'll start addressing the strength. Now, there's many, many muscles in the area. So for me as a specialist physical therapist, I'm having to kind of, dissect the case and look at every single muscle that can be contributing, all the relative strength of each muscle. We look at muscle imbalances. We look at their past activity levels. Many of the ladies coming in right now have been exercising regularly. So, when I talk to them about strength, they're saying, well, I've been working out. I'm sore every week from going to the gym. I have a trainer even. But they're not addressing the right muscles in the right way that's going to maximize the impact on straightening out that neck hump. That's the problem that I'm finding. So most of the time, there's an upper trap problem. So if you look at the names of muscles, the trapezius, or for short in the medical field, we call it the trap. So the upper trap, because there's three parts to it. There's an upper, a middle, and a lower. But it's usually upper trap strength that's an issue. And there's special ways that we have to exercise it and strengthen it over time to get the effect that we're looking for. So it's a complicated process, actually. It's not as straightforward as just saying, oh, well, he said I need to strengthen my upper trap. I have the neck hump, so I'm going to go do that. Let me look up a YouTube video and let's get this going. That is just half of the piece. There's much more that we need to look at. But I can tell you that if you've got a neck hump problem, chances are 9 times out of 10, you've likely got a serious weakness somewhere, and the trap might be the first place to look. Other muscles that contribute to this, there's deep neck flexors, there's scalenes. This might be, a little too technical, but if you wanted to go look it up, you can find out the names of all these muscles and where exactly they are. Those are probably the top 3 contributing weaknesses. But anyways, let me just get into the mechanics of this. And so if you're not very science-minded, follow me as best as you can. I'm going to do my best to keep it as simple as possible. So visualize the neck hump. What's going on is it's your spine that's right there. It's the upper part of your spine. It's bending over forward because the muscles that are supposed to hold it up straight are too weak. And it tends to bend over forward because of gravity. Gravity just pulls it over. You can straighten up, like we talked about with posture, and that does help, but it's a short-lived effect. Versus if you're strengthening, if you're exercising in such a way that is generating the strength for your muscles to hold you up better, hold up that part of your spine better, without you consciously thinking about it, that is where the gold is. That is where you reverse this problem for the long term so that you're not ending up with some side effect to this neck hump issue that is going to lead into a surgery or having to rely on pain medications and injections. So I hope that is simple enough for you to understand. Hey guys, by the way, if you ever have questions or anything, you can reach out to us. You can go on our website and there's a little place where you can type in questions. You'll see it's a little pop-up. You can also call our clinic if you're concerned about something you want to talk to us. We have people do that all the time. So just a little side note in case you're confused about something, and wanted to learn more. Anyways, let me keep going here. So strength is number 2. Posture was number 1 factor that I talked about that contributes to the neck hump. Strength is the number 2 factor that contributes to the neck hump. The third one is activity level. Now, if you're just sedentary, whether it's by choice or not, because that happens sometimes, and examples of that would be, you have a desk job and you just have to sit in front of a computer to do your work. That's, to a large degree, that's kind of out of your control. You just have to do it. If you just had a child, we see a lot of ladies that begin to get the neck hump when they become new mothers because they are now stuck carrying a baby. They're, for months and months and months, for at least until they're, close to a year old, maybe longer. And, if you have multiple kids and you go through that multiple times, and so that weakness and that posture just accumulates over the years. On top of that, nursing a baby, you're kind of hunched over, you're looking down at the baby most of the time. So it's going to affect that neck hump part. And many women do tie this back. The older ladies that we get that their kids are all grown up, maybe they even have grandkids at this point. Sometimes they'll tie back the formation of their neck hump to when they were in their 20s and 30s when they were having kids, and that's when it kind of all started, and it's just gotten worse and worse over the years. Now they're in their 50s and 60s, and it's causing a problem. That's kind of the typical story that we hear. But we do get young ladies in here as well, and men that get the problem, and it's it just affects them sooner in some different way. So I'll talk more about why that is here in a second. But let's hang on activity for a bit. So if you're not moving very much, what happens to your muscles, those same ones that are weak up in the neck, is they kind of shut down. Muscles are very cool organs. They are super smart in that if you don't lose them, they start to atrophy, or they kind of get smaller in an effort to be efficient within your body. And, of course, it's not desirable to have smaller muscles, but in the grand scheme of the body, that's a pretty cool effect that it has. The other thing that muscles do is they almost shut off, they turn off. When you're not using them for a long time, in order to reserve energy and nutrition and all that, they literally will not work. And so if you're sitting for a long time and you don't really need that muscle because you're going to be sitting for another few hours, those muscles just turn off. Now, it's a bad thing when you need to become active again, and that muscle has to kind of warm up and wake up over time. But if you're chronically sedentary because, say, you have a new baby and you're going to be holding that baby again within minutes or hours at most, then that muscle just never gets the activity that it needs. The more activity that muscles get, the better they can operate and affect the joints that they're supposed to in the way that they're supposed to. So I want you to separate this out from strength. Strength and activity are two separate things in my mind, because when you get stronger, that strength is carried into your sedentary positions and it helps you to maintain your posture. But you can have good strength. You can be able to pick up significant weight. But if you go be sedentary for a while, even if you have that strength, those muscles can still shut down and cause problems. And you can have both come together. Obviously, you lack the strength because you haven't exercised at all in a long time, and then you can also be sedentary on top of that. And so now you're stuck between a rock and a hard place. You're weak and you're not active, and your muscles are shut down. So both need to be a component of each other. So if you're out there and you've got a desk job and you're a new mother, or you've had kids in the past and life has just never been the same for your neck and shoulders, and you got the hump developing over the years, over the decades, I strongly encourage you to go start getting stronger and definitely get more regular activity. And just to put some specifics on regular activity, because I'm not talking about it, but it's very individual. If you've got a desk job out there, you've got to move every 30 minutes or so. Even if it's small, even if you just stretch, even if you just do some simple exercises that take, 30 seconds or a minute, that makes a big difference over the course of a day of working at a desk all day. Right now we're in the COVID time. So if you're stuck at home, you're working from home, and then you might not be very active outdoors because they're not letting you go out. You might end up watching Netflix at home or something similar. And so you're kind of more sedentary. You just have to build in some sort of physical activity. Go, do some chores around the house, or go do some yard work outside if you can. Get some movement so that your muscles have to work. And I would work enough to the point where you feel like you're going to sweat, like you're going to perspire. That is usually enough to warm up your muscles and use them enough to move the joints. So I hope that makes sense. Now let's talk about the final contributing factor. And this is the one that's least in your control. That's why I put it here. Genetics. Your genetics, who are your mom and dad and who are their mom and dads, and what kinds of genes did you get? What kinds of a body type did you get? Just like we know that if you have a history of heart problems in the family, or diabetes, or cancer, certain cancers, you are going to be more likely to get those same problems if you don't manage your health well. Obviously heart problems, almost all heart problems and diabetes are definitely preventable. And just because your mom and dad might have it, or other relatives might have it, it doesn't mean that you're absolutely going to get it. It just means that you're more likely to get diabetes, for instance, if you don't take care of your health. But chances are that if you eat well and get enough exercise and manage your health pretty good, you're likely never going to get diabetes, but you're still genetically predisposed, and you're going to pass on that genetic predisposition to your kids and grandkids. So that's just the way life is. And every race out there has its own genetic predispositions for certain problems and illnesses. Well, it's the same thing in joints and muscles and bones. And what I find is that people that tend to have longer necks, kind of more slender builds, will usually get this neck hump problem quicker than others. Now, it's not a hard and fast rule. So if you're out there and you're thinking, oh my gosh, I'm in olive oil myself, I'm kind of long and slender, and I've always been thinner, it doesn't mean that you're going to get it. There's other factors that contribute to this. That's just what I tend to see. I've seen short people get it. I've seen stocky people get this issue, the neck hump problem. So it's not a hard and fast rule, but it's just one predisposition to getting it for sure. Now, if you know that mom and dad had this problem, or grandma or grandpa had this problem, then I would be just extra concerned about it, especially if you're becoming a new mom, or if you've had a desk job for a while, or if you're already getting some sort of neck pain. Even if you don't have the hump developing yet, that's a sign that you might be getting it soon. And the hump doesn't come on suddenly, by the way. It's not something that you wake up with the next day and it wasn't there the day before. It gradually comes on over time as you get weaker, and as you spend more time sedentary and your posture's not as good. All those factors contribute to this problem, and it just goes by quicker if your genetics are predisposed to it. So think about that factor as well. Now, if you end up having a neck hump problem and you're not really dealing with any pain yet, or maybe you're just starting to deal with some pain, people usually get achiness, burning sensations, tightness in the muscles around it. It's sensitive when they poke back there, if they touch the bones or just touch certain areas of the upper back, lower neck area. It's just very tender. They tend to have problems leaning up against certain chairs, certain couches that put pressure on that area they don't like, and they tend to have other related issues over time. So people with this problem are more likely to get neck arthritis, osteoarthritis in the joints of their spine. They're more likely to have pinched nerves. All the nerves come out of the neck, and so they start getting affected over time. On the neck hump part, if what's going on inside the spine, without getting into too many technical details, is the joints are being compressed on each other. So the cartilage is getting squashed between the joints. When cartilage gets squashed, it gets dehydrated, which means that it's not going to move as good, because cartilage is supposed to be very hydrated so that it's slick and there's less friction between those bones so that movement can happen. But if you've lost that that lubrication from the cartilage, then the joints get stuck. And if it stays like that for years and years and decades even, then the joint surfaces begin to change, and that's how arthritis develops within the joints. And when we see people that are in their 70s, 80s, 90s, and they've got this neck hump problem, many times at that point when it's been going on for decades, it's not reversible much. And we're just talking about what can be done to not hurt so much, but we're kind of conceding on that it's going to hurt. We're telling these people, you know what, you're just going to have to live with this problem. If there's no other options for it, you're just going to have to live with it and manage it. Here's what you can do to not make it so bad. But if you're in your 60s, 40s, 50s, in that age range or younger, chances are you've got a great chance at actually reversing it. You haven't had it as long enough to get the joint surfaces to change and become arthritic. Now, you can get, like I said, those pinched nerves that can turn into other stuff like carpal tunnel syndrome. It can create pain in the shoulder because all the nerves that go out into the shoulder. When those nerves get pinched, they reduce the effectiveness of the muscles they connect to. So shoulders don't work normally, and that can set up shoulder problems like rotator cuff tears and shoulder labrum tears. There's all kinds of other shoulder problems that are affected. Of course, arthritis in the shoulder is one thing. If the muscles aren't working right, the ball and socket joint of the shoulder just doesn't move normally. And if that's going on for years and decades, then you get arthritis in the shoulder. So this is definitely a root problem. This neck hump issue is a root problem to many other neck and shoulder related conditions that people end up getting surgery for, or injections, or live off of pain medication for. So it's a bad thing. You just don't want it. And if you feel like you're getting it already, do something about it right now, because you can prevent a whole bunch of problems later on in life. And what I always like to tell my younger patients is, if you've got this thing going on and you're in your 30s, you need to teach your kids about this, because they're probably going to have it when they get to their 20s and 30s. And so you need to educate them about how to manage their own body if it's a genetic predisposition that you've got. All right, let's kind of shift gears here, and let's go into the top 4 ways to reverse this problem. So I've alluded into a few already, but I'm going to get into some nitty gritty about this. So number 1, get regular exercise. So I talked about that when we were talking about the activity part of, earlier on in this podcast. But let me break this down. It's critical for you to regularly, what I mean by regularly is at least 2 to 3 times a week, go do something that gets your heart rate up. You end up sweating at least a little bit. Not everybody sweats the same, but if you start to generate a bit of a sweat or feel like you're going to sweat, if you're just the type of person that doesn't sweat much, that's usually enough to warm up your whole body and move virtually every joint in your body to some degree, so that you're not getting them stuck and you're activating muscles so that you're keeping them from shutting down all the way. So especially if you're a desk worker, I would up that. I would venture to say that every day that you have to work on a computer and be stuck at a desk, build in time about 20 to 30 minutes where the activity is vigorous enough to get your heart rate up pretty good, where you feel your heart pounding inside your chest. And of course, if you've got any sort of other conditions that might be flared up by exercise, talk with your doctor about that. But if you're free of that, then go start exercising right away. So it could be, for some people, it's as simple as going on a jog. That tends to move all your muscles in your body. Doing some sort of workout video on TV or on streaming. Everybody streams now these days. Those are fantastic. And you might, if they're shorter, if they're just 10, 15 minutes long, do 2 of them. Do 2 back to back, or take a short break between. If you have a home gym, get in your workout. If you can go to the gym, if you choose to go to the gym and get your pump on. You need to do exercise that moves your entire body. It is critical for your overall health. And it's just, what I tell people is, it's like flossing and brushing your teeth. If you go to the dentist, if you're not flossing and brushing regularly, they're going to tell you something about it. And even if you are flossing and brushing regularly, you're going to get tips from the dentist. You're going, like when I go to the dentist, I as a kid, I had lots of cavities. I didn't brush very good. I never flossed. And it was always dreadful going to the dentist because I knew they were going to find a cavity or find something that needed to work, and they were going to pull out the drill, and it was going to be miserable. Then I flipped it and I said, all right, I'm flossing every day and I'm brushing 2-3 times a day. And that started happening, and the dentist was all of a sudden happy. But then he started to still pick on me and say, hey, that spot back there on that molar, you need to just brush it a little bit longer than you have been. Or this spot over here between these teeth, you need to get the floss all the way in there, maybe even go in there 2 or 3 times to get all the stuff out. And it was great. I began to love it at that point because I said, I know I'm on the right track. I just need to do more of it in the way that he's telling me. Same thing with exercise. If you're already exercising, you need to start finding, well, which type of exercise is going to be best for me for my neck hump problem, for my neck issue, for my shoulder issue. Which one isn't going to hurt me but is going to help me? So be thinking about that. Let's talk about strength training. So I'm talking about weightlifting or anything where you have to really push your give it a good effort for a few seconds. This is kind of the opposite on the spectrum of exercise. This is the opposite of cardiovascular training. So on one end of the spectrum, you have cardio, where you are moving consistently, like going on a run or elliptical or bike. Those are common cardio exercises, and you might be there for 10, 20, 30 minutes or more. Strength training's on the other end, where you're doing something intense for just a few seconds, and you might do, just so many reps of it. Strength training is super duper important for this neck hump problem, for strengthening the muscles. Now, how you do it, the down to the nitty gritty specifics of it is important. What I tell people a lot of times to fix their upper trap strength is to do overhead weightlifting exercises. Doesn't need to be super heavy to start out, but eventually it should increase enough to where it's some effort and it's some significant weights for that individual. When I say significant weight for that individual, me, I'm over 200 pounds. I'm 6'2". I'm a decently big guy. So I need to pick up some decently big weights. But if you're a 5'0" small female, barely 100 pounds soaking wet, you need to pick up some significant weight for you. And that might be starting at 5 pounds or 10 pounds or not even that. If you've got a neck and shoulder problem right now, you need to go even easier, maybe no weight. But you need to work up to a significant weight once you get stronger. So it's relative to the individual and their current ability. But it needs to be in such a way where the exertion that you have to put on the weights to push them up overhead or to perform the exercise is pretty high. On 0 to 10 scale of exertion, you need to be like at 6, 7, 8, or 9. A 10 would mean it's your most weight you can lift in 1 or 2 single reps. So it needs to be about that much. And you might work up to it. That doesn't mean you need to do it right away. If you've never lifted weights overhead in your life or you haven't done it in a long time, I'm not saying go start doing it today and get to a 9 or 10 because that's what I said in this podcast. Use some common sense and work your way up to it. And it's probably going to be months before you get to the point where you're like, all right, I'm going to pick up, the most weight I've ever picked up once overhead because that's what I have to do. You may never even do that. You might always stick to an 8 or a 9. But strength training is critical. The reason why is because when you exert yourself like that and it always makes you sweat, it always gets your heart rate up, and you have to kind of mentally focus on it. You cause your muscles, you cause a cascade of hormones and other effects inside your muscles that turns on the muscle growth, that kicks in the factors that make the muscles say, hey, we need to develop more. We need to get thicker and stronger for the long term so that we can continue to lift these weights again and we can hold up joints and hold up the spine better. And that's how you get that long-term effect. Now, the posture, the technique, the form is important because when you strain yourself that much, when say you're going to do just 30 reps and you're going as hard as you can, as heavy as you can, form tends to fall apart. And one of the first things I do when people are pushing the weights up overhead, one of the first things I do is tell them, you need to tuck the chin in. Don't let your chin jut out. Don't get into that computer head posture. And you need to make sure your shoulders go up all the way. You need to shove your shoulders up into your ears. That's always missed. People don't go up high enough. You need to think about bringing your shoulder blades up 110%. Most people are just going at 70 and they're not really aware of that part. I'll get behind them and I'll shove their shoulders up from the sides of their body to give them the effect that they need. And it needs to happen like that every single rep. And if you're not able to do that right now, then you need to lower the weight and just practice the technique. You might need to hang out there for a month or 2 or 3, and until you can effectively get the technique down right without hurting your neck or hurting your shoulders in some other way, don't add weight. Just stay where you're at and get the technique down. It's like training wheels. I have 3 kids, and my older 2 took off their training wheels already, and they're riding their bikes normally. My oldest had his training wheels on for probably the better part of a year, and we had some relatives telling us, take the training wheels off, just take them off already. He's looking like he's ready. And I said, no, just wait. He's not bothered by them really. He's not concerned about them. Nobody's telling him anything, and he's enjoying riding his bike. And I don't want him to have a broken bone or fall that we could have prevented. I would rather wear those training wheels down until to a nub, till there's no more plastic left on them, before letting them loose. And it was a great decision. Once the training wheels finally came off, he was expert at riding the bike. That kid is all over the place now. So I was very comfortable letting him have the training wheels on. Just like I would want you to be comfortable saying, I'm not picking up heavy weight yet until my technique is very good. Then once I'm comfortable with my technique, I don't have to think about it so much. It just happens. Now I can add the weights and I can go on. So I hope that helps. Okay, number 3, posture. Let's talk about that. This is kind of related to the last thing I was talking about with strength. There's no such thing as being in the best posture ever for long periods of time. Your body needs to move. Let me say that differently. You can get in the best posture ever, but you can't stay there. You just cannot stay there for more than about 15 or 20 minutes effectively. Our bodies are meant to move. Remember, those muscles shut down if they don't get some activity. So even when you're in good posture, it's the same rules that the muscles follow. You need movement. So I wouldn't worry too much about posture. What I do with patients when they come in is we'll have a talk and I'll tell them what good posture is, but I don't make it a big deal, and I don't really visit it much after that because it's not something that I need them to be thinking about all the time. If you've gone down the rabbit hole of trying to figure out what good posture is for you, and you've researched it and you've talked to people and you've bought a device about it, I've seen people that have that. They have little sensors that they can put on their clothes or on their body, and when they start slouching, they get a notification on their phone, or there's some that even give you a very small shock, they electrocute you just a tiny bit to train you to keep your posture better. That's cool and all. And for the most part, most people, I'd say 8 out of 10 don't really have terrible posture. They just have slightly bad posture, and improving it a bit's only going to create a minor effect on their neck hump problem. It really isn't going to make a big difference like strengthening will and keeping up regular exercise will. So posture is a small factor, but some of the big things that just most people aren't aware about is get your eyes checked. If you're leaning into the computer screen because you can't see, it might be a way better effect to go get your eyes checked and get an updated prescription if you wear glasses already, or start getting glasses if you haven't. Or, if you're getting a little older in age and your eyes are being affected by that, going to go get some reading glasses could be a factor. I've had some people that I've told, especially the ones that wear like bifocals. Of course, you've got the 2 lens, or there's even trifocals out there. You've got multiple lenses on the same glasses. And in order to look through one lens, you have to tip your head up a bit in order to access the reading lens, the ones that let you see close up. And then you tip your head back down to look at the upper lens, which allows you to see farther away. Well, think about this. If you're tipping your head up all the time to read your computer screen, it's making you jut your chin out and possibly stick your head forward. That's going to create that neck hump situation more frequently. So it may be a good idea. Maybe your glasses work just fine, but you need to go to the optometrist, the eye doctor, and get yourself a set of glasses that are, full size, and the entire lens is just for reading. And you keep those glasses around you whenever you're working, whenever you're at the computer. So you need to have a pair of glasses that are for reading, and then your normal glasses for everyday use. That way you're not having to tilt your head and mess with your spine, your neck position, and get your back and your upper back, your neck hump area into that posture. That way you can keep it up straighter. So that might be an easier thing to do than having to constantly think about, I got to sit up straight. I got to make sure that my chest is out a bit and my head's tall, and all the things that people say. I would go fix that first, though, before you start thinking all day throughout the day about your posture. So then that was number 3, top way to reverse the neck hump. Let's talk about number 4. Get specialist help. Undoubtedly, I think this is the most important thing. It speeds up the process. It eliminates confusion. It just gets you on the right track as fast as possible. And it's the express highway to fixing this problem, because what I see is, again, people come in their 50s and 60s and beyond sometimes with a carpal tunnel problem or a shoulder problem that's related to this neck hump problem. And they've been doing something about it kind of over the years, but it hasn't been that effective for them. They've looked up some videos here and there. They've tried a couple different things, and it just didn't get them the effect they needed. And now they're faced with, this neck arthritis problem, this herniated disc in their neck, this pinched nerve, this rotator cuff issue, this numbness and pain in their hand that's related to carpal tunnel or some other nerve problem. And it's a mess when I have to help them out. I'm going to help them, and that's what I do here anyway, but I have to tell them, all right, we got to free up this nerve, we got to loosen up this joint, we got to strengthen these muscles, and we have to make sure we address the hump in your neck, because if that doesn't go away, all these problems are going to return right away, because that's the root of the issue. So getting specialist help allows you to fix this problem way faster and more effectively, and most importantly, you can learn what you need to keep doing for the long term that's most effective. You're not having to, you can whittle down the 10 things you were doing to 1 or 2, and that's going to help you the most for the long term. So when I talk about a specialist, you need to find somebody in your area, ideally. If you're in the El Paso, Texas area, of course, here in the clinic, we deal with this problem all the time. We're specialists at it for sure. And hopefully you're looking for some non-surgical way to deal with this. I can tell you, most surgeons out there, if you don't have some herniated disc that's pinching on a nerve, or some massive instability, like where the joints are overly loose, they're not going to operate on you. And the neck hump, they don't do anything about. They'll just give you injections, if that, for pain, but they don't really know what to do to fix it for the long term. And even if they find a tear or something that they can't operate on, it's not correcting the strength problem, it's not correcting the posture problem or the activity problem. That's still for you to correct. And I've seen people go get surgeries for a herniated disc or something in the neck. They get the rods and screws put in to straighten out, a segment of the spine. But if they never get the strength back, it's just a matter of time before a level that wasn't operated on becomes affected, like the one that ended up getting operated on. And then that person goes back for another surgery. And it's the same cycle that they get stuck in. So it's super important to make sure that you fix the root problem. And it's going to have to be under your control. In other words, you have to be able to know, what do I need to do when I get a little bit of pain, or when I see the hump starting to get worse? I need to know what to do on my own, so that when I get to 50, 60, 70, 80 and beyond, I'm not dealing with this neck hump problem, and I can have excellent quality of life and enjoy everything that life has to offer at that point in time. So guys, that wraps up the podcast. We answered in depth the question of, why do I have a neck hump? And then we went into the top 4 ways to reverse a neck hump. I hope this was helpful for you. If you like this, please share this with somebody that you think probably needs to hear this, and subscribe to our podcast to hear more information related to neck and shoulder problems and other body parts as well. and give us a review. If you found that this was helpful, give us a quick 5-star review. If you tried some of this stuff and found that it made your neck and shoulder problem, your neck hump problem better, tell us about it on the review. Just explain everything about it. I'm sure that people will benefit from seeing these reviews. So I hope you have the best day, and we'll talk soon. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.